Patrick, are you good to go?
I'm going right now.
Pretty good.
I'm kidding.
Jamie, yeah. Yeah, he's got hit by a truck. Yeah.
Everyone prepared? Good morning. Thank you for coming for this very important press conference. I want to begin by thanking Baystate Health for their ongoing partnership and their hospitality in allowing us to host this press conference here. I am joined by Chief Paul Madera from the Ludlow Police Department, Captain Christopher Wilcox from the State Police, assigned to the 14th to March 17th. There was a string of overdoses, both fatal and non-fatal, in the towns of Ludlow and Agawam here in Hampden County. This resulted in, as a result of those people in some numbers coming to Baystate Health, exhibiting signs of an overdose, that law enforcement really came into action to stem the tide of these overdoses with the acknowledgement that there was a fatal strain of opiates being distributed in that region, and particularly from the town of Ludlow, by a small group of individuals to a number of people who were experiencing overdoses. The suspicion at that time, and to this moment without confirmation, is that they were triggered by a strong presence of fentanyl in those opiates that were being distributed. The genesis of law enforcement's response is really due to and in thanks of Baystate Health, and in particular Dr. Beltran, who stands beside me. Being in the emergency department here, these overdoses were coming in at a really irregular rate, and that resulted in Dr. Beltran and his colleagues contacting the state police assigned to my office to alert them to this issue, that people are coming in at a high rate of overdoses, exhibiting signs of overdose, really that were much stronger and much more difficult to deal with medically than usual. That resulted in the state police, along with the Agawam and Ludlow police departments, led by Chiefs Madera and Gillis, working with the state police to really specifically, in a very focused and swift way, conducting an investigation in that period of time that resulted in these several arrests that from that point forward really was able to stem the tide again of those overdoses. Those arrested in connection with these overdoses were Frank Jimenez of Springfield, Christopher Fitzpatrick of Ludlow, Daniel Moffitt of Ludlow, and a fourth suspect, Bradley Hoffmeyer, also of Ludlow, is currently being sought on a warrant. These suspects are facing charges for the suspected sale and distribution of opiates, which caused 3 deaths over a 10-day period in March. Specifically on March 16th, the State Police Detective Unit assigned to my office responded to Baystate Health and its medical center investigating the death of Mr. David Simonoko of Ludlow. He suffered from symptoms consistent with a drug overdose in Ludlow, and that was allegedly at the distribution of Bradley Hoffmeyer, also from Ludlow. In the same time period, in March 15th, that is when Dr. Beltran, Chief of Pre-Hospital Disaster Medicine for Baystate Health, contacted the State Police Detective Unit assigned to the Hampden District Attorney's Office to report this to the trauma team and to report it to State Police, citing a higher than normal volume of patients suffering from drug overdoses. In particular, 8 patients came to the emergency department here at Baystate Health over a 24 to 48 hour period exhibiting signs of an overdose. 7 were revived by the trauma team and their skill and commitment, utilizing life-saving medication, naloxone or Narcan. 1 of those overdoses was indeed fatal. I do want to note the seriousness of the overdoses, that in particular, and Dr. Beltran can address this, that a number of Narcan doses were administered to save many of these people, where ordinarily 1 or 2 doses of Narcan are sufficient. I do want to introduce Dr. Gerald Beltran to speak about what he experienced and his foresight in contacting law enforcement to ensure that we could save lives. So now I introduce Dr. Gerald Beltran to talk about his role. Thank you.
Good morning, everyone. So, as was mentioned, during that particular time period, from over the period of about 48 hours, the Department of Emergency Medicine at Baystate Health actually noticed an uptick in the number of overdoses we were seeing, and quite a substantial jump. And at that point, some of the doctors and nurses started compiling statistics and presented that to the department to forward to law enforcement because we were concerned about the risk to public health with the number of those injured and, as was mentioned, a death as well. That information then was conveyed to the Correction State Police as well, and they took that information and worked with it. And what I'm learning today is they developed a strong case and are working at closing that out. So that's what we had noticed. I do want to mention too, he had mentioned one of the things that we had seen out there was that the amount of Narcan required to get people breathing normally is higher. Normally it takes 1 dose, maybe 2 doses. I won't go into specific doses, but we were having to use sometimes 30 to 70 times more the amount of medicine to really get people to respond, where we would normally have to use just 1 dose. So we did notice that phenomenon as well.
Thank you, Dr. And I do want to be specific around the issue of Baystate's communication with my office and the state police. Needless to say, HIPAA laws were very strictly observed, but the notion that this was clearly a spike in overdoses was communicated to law enforcement, which I'm very proud to really highlight here to the public, is that resulted in a swift and very focused investigation led by Captain Wilcox, Chief Madeira, and Chief Gillis and their people to make sure that we stop this and I think literally save lives in the process. And we're very proud about that. And that is the relationship that has been fostered between the Hampden District Attorney's Office, the State Police, the Ludlow and Agawam Police Departments, and Baystate Health. And I think that really benefits the public, I think here specifically in saving a number of lives. What I did mention is that there were 3 overdose deaths related to this distribution of a substance that we suspect at this juncture, strongly suspect, is at least in large part fentanyl. And I think that is borne out by the fact of what Dr. Beltran said regarding the amount of Narcan that was required to save some of these lives, where ordinarily it's 1 or 2 doses. In this case, it was upwards of 30 doses of Narcan to save 1 individual suffering from an overdose. What we have also gleaned from the investigation, again, makes it rather clear that this, at least in large part, was a substance, was opiates that was mostly fentanyl. And as we know, fentanyl is, in often circumstances, 50 or 100 times more potent than just heroin. So it was a very dangerous batch of opiates, and that is why law enforcement's response, triggered by Baystate Health, and particularly Dr. Beltran, was so critical to saving lives. And the product of that investigation, as I mentioned to some degree, was a number of arrests. I want to give the press here some particular figures. Mr. Jimenez was arraigned on March 23rd in Springfield District Court on distribution charges. He's being held on $100,000 cash bail. Daniel Moffitt was arraigned March 21st on charges of drug possession to distribute and distribution. He is held on $25,000 cash bail. And Mr. Fitzpatrick, Christopher Fitzpatrick, was arraigned on March 22nd, also on possession with intent charges as well as distribution charges, and is held on $10,000 cash bail. Mr. Hoffmeyer is being sought out of state actively as we speak by the state police and its counterparts in those states where we believe he is hiding. I do want to make clear also to the press, and this is an important point, that my office and my team is presently reviewing these cases for additional charges. I would suggest to the press that additional charges, at least on some of these individuals, are very likely, and those will include manslaughter charges for the overdose deaths involved in this investigation. In the Ludlow Police Department, under Chief Madeira, again, I think really benefits the public by our working relationship, by our communication that we've worked very hard to establish. In this case, I feel comfortable saying we saved lives by this communication, by this work, and a swift, aggressive, and focused investigation into these distributions and this very lethal strain of opiates that was emanating out of Ludlow. And I want to thank Baystate Health again for their great work. They really save lives, obviously, on a daily basis, and they do such a terrific job saving those coming in with signs of overdoses into their ED, and really give people an opportunity to rehabilitate, give people an opportunity to get well after that really watershed moment of an overdose, by saving their lives, giving them the services they need, and hopefully giving them and putting them on a path towards rehabilitation. So I'm very proud to announce these arrests and the collaboration and partnership that was really the genesis of this. I'm happy to take any questions.
Anthony, are these bails high enough, especially for repeat drug offenders? We often hear judges talk about how these people are just getting out too often, these bails are too low.
Yeah, Matt, I don't know if the judges are talking about that. That's a subject of conversation, I think, among myself and some other elected officials. Certainly in law enforcement, it's a source of some frustration. I think here, without having reviewed the files specifically for the purposes of bail, with regard to records and so forth, the bails here were sufficient to hold them. With regard to Mr. Jimenez, I mentioned it was a $100,000 cash bail. That, to me, considering the charge here, and I'm speculating to some degree, not knowing the files and the records in particular, has probably most to do with their records, considering the charges are very similar. And I think there's a clear notion that other charges would come, and I would imagine that would be contemplated by the judges setting bail.
Has it been established that these overdoses were all connected to the same batch of heroin, and have these suspects been directly connected to these overdoses?
By way of the investigation led by the state police, yes, I'm comfortable saying that these overdoses were all as a result of a similar strain of heroin, at least, probably coming from the same source, back in the chain at a certain level. The individuals involved in this case were really distributing at a street level, and we believe that they were all connected socially, and that they all were getting the heroin around the same time from the same sources. And the investigation leads us to believe that it's all connected. While there were some that only triggered the investigation by the state police, Ludlow and Agawam police departments. And that investigation over the course of 3 or 4 days, around March 15th and 16th, was directly attributable to these arrests. I mean, there was nothing that came before that. I think the Ludlow Police Department was aware of some of these individuals, and that obviously there's some distribution of heroin in town. But I think the arrests that I announced today are specifically related to this effort and this investigation. And again, the genesis of that is from Baystate Health alerting us to this spike in overdoses.
Tony,
Where this exactly came from, we just don't know at this point. We do believe, based on the overdoses being quelled, that we were able to get a good amount of this off the street, and the particular people who had possession of it and who were distributing it are now locked up. And I think that's evidenced by, again, the fact that the overdoses to a large extent have stopped. But the Ludlow Police Department, Agawam Police Department, and State Police continue to be vigilant and to work in their respective towns to make sure that anybody who's distributing drugs is taken off the streets. And again, that is really to save lives. And Patrick, you've heard me say this a number of times before. We really have to draw a distinction between the people who need and deserve our help, those who are suffering from addiction, and the people who are profiting from addiction. And I think these people, in many ways, were profiting from addiction, and it was their actions that directly led to deaths and near-death situations in some of these overdoses. So, this is the work of law enforcement. This is how we really have an impact on people's lives and the public health and safety in towns like Agawam and Ludlow. Mr. Herschel.
Can you talk a little bit about the use of Narcan? We hear statistics that last year, for example, the number of overdose deaths has declined, but yet the problem continues. And does Narcan, in a way, mask some of the problem in that individuals are revived through overdoses? But that begs the question: what about treatment down the road? Are we just kicking the can down the road here? But can you talk a little bit about Narcan and the number of overdose doses you're talking about now? Is the problem increasing continually?
Dr. Beltran may be able to augment my answer. and Dr. Friedman is here, who's an expert. And Dr. Charvet, too. We have a number of experts here who know a lot more than I do on many subjects, but from a law enforcement perspective, Mr. Herschel, I think we're seeing declines in overdose deaths as a result of a number of things, and I'm certainly reticent to take any credit for this, but I think it's been generally law enforcement's strong response to this crisis that has and is leading to improvements and to lives being saved. And we've worked through my office both on the supply and demand end, so to speak. In terms of demand, we're engaging in a lot of very proactive programs and working with a lot of community organizations to help people who are dealing with addiction and provide services. But also on that supply end, Mr. Herschel, we're focused, as we are here today, on making sure that those who are profiting from addiction and spreading this death and destruction are taken off the streets and brought into the court system and brought to justice. And we're working very hard to hold them accountable and make sure that we send that point to other people who seek to profit from people suffering, that the court system is going to hold people accountable, and you're going to be jailed and you're going to pay the consequences. I think Narcan, in my opinion, and if Dr. Beltran seeks to answer, or any of the doctors here, I think they can probably add more than I can. But from my perspective, if we can save a life, irrespective of, you want to argue this encourages people, it's a sort of, safety net. To me, if we can save a life and give somebody an opportunity to turn their lives around, to beat that addiction, to become well, to get into recovery, that's something I'm a big proponent of. I think Narcan is literally life-saving, and more accessibility and the hospitals using it to save lives is something I'm obviously very much in support of. Dr.
Well, good morning. So I'm Peter Friedman. I'm the Chief Research Officer and Associate Dean for Research here at Baystate. I'm also an addiction medicine clinician researcher and president-elect of the Massachusetts Society of Addiction Medicine. There's a lot actually in the news about this particular question, whether having more naloxone, which is Narcan, available, and a whole lot that people would welcome in any way. So it is life-saving. You hear all these urban myths about, Narcan parties and people using more, and really that is just an urban myth, or in some cases a rural myth. It really is life-saving, and Massachusetts really has led the way in terms of naloxone distribution. We see declines in mortality in our state at the same time that in a number of our surrounding states that have not been as effective in distributing Narcan, there have been increases in mortality. So I appreciate us, sort of questioning what we're doing, but it seems to me here the evidence is very clear. Thank you.
I find it fascinating that the DA said that it took 30 doses of Narcan to revive some of these individuals who came in with overdoses. That to me just seems like they were a hair from death. I mean, that's how strong that fentanyl was and how close they were to dying.
Doctor, you had said between 30 and 70 times more Narcan.
The normal dose that
right,
would be...
So not 30 doses, right?
Well, actually, in this case, it was 30 doses because they were doing 1 milligram, without going into specifics,
Okay.
but it was. So, yeah, good point, but it is a substantial amount. We're seeing it in the field. I do want to add into the statements that were both made here about what's been happening in Massachusetts. The legislature's done a great job providing Narcan, making available to first responders. So, for instance, police, fire, they are using that in the field, and also families. I work in the pre-hospital environment out in the field as well, and have seen family members that have given this medication to get them breathing again, because that's what the people die from. It basically suppresses the respiratory drive, and they stop breathing. So by giving the medication, it takes 5-6 minutes sometimes on a response. That's 5 to 6 minutes where the medication's starting to kick in and they're starting to breathe again. So that's been, I think, a huge benefit. The other thing that the legislature's done that's been very helpful, here we go, but Chapter 111E, Section 9A, it actually encourages and allows police to take people into protective custody and ensure that they actually get to the hospital. And I think we're seeing a lot of departments now doing the community caretaking role and encouraging their officers to do that so that they do get to the hospital where they can be monitored. one of the side effects that we do see from Narcan, and Dr. Friedman can talk about this more, is that as the people get the medication, the Narcan oftentimes will wear off faster than the opiate medication. So in other words, they still have the opiate medication. It also depends what they have on board. If you look at methadone, that lasts a long time. That's going to be many times that they're going to need to be reversed, if you will. So we are seeing the effects of public policy, public health, efforts of law enforcement, EMS and fire trying to address that, and that may be some of them.
So from your point, from what you were seeing, there were cases where 30 doses of Narcan were administered to one individual.
That is correct.
Thank you.
The thing about, so compared with heroin, which used to be the opiate in the street supply, fentanyl has a much stronger binding to the opiate receptor in the brain. That's sort of what's causing the suppression of breathing. It also causes the euphoria. It has much stronger binding, and so in order to kick it off the receptor, you do need much higher doses of Narcan in order to do that. A lot of folks in the community are using the nasal spray, and again, the ability of that to get into the system is not as great as, say, the intramuscular or intravenous route. So when they come in, they typically will through veins or through the muscles, right, rather than through the nose. So that's what we see people out in the field giving a lot of the nasal, and then when they come in, often they end up needing it by vein, which I imagine is what is happening in the emergency department.
Thank you.
And you see from the statements by Drs. Friedman and Beltran the lethality of fentanyl and why we need in the criminal justice sector to take it so seriously. So the public is learning about how dangerous this is, and I think the court system has to react to that and has to be mindful of how fentanyl is really changing the sort of specter of overdoses and has such a potential to breed such devastation. And here we saw that with this spike in overdoses. And again, the assumption at least is that this, this substance that was being distributed was to a large extent fentanyl. It just is so much more potent than heroin. You see how difficult it is through naloxone to really save lives of those who are overdosing on fentanyl. So it's incumbent on the court system in my office to make a very strong statement as to how we deal with folks who are charged with fentanyl distribution and trafficking.
So this came about largely because Baystate notified, what was it, state police?
It was the state police assigned to my office.
Sure.
Correct.
Yeah. So does Baystate, and maybe Dr. Beltran or Freeman could answer this better. Does Baystate have an official policy for notifying law enforcement now for high level cases of many cases of overdoses?
So I don't know, I would not say there's necessarily a formal guideline on that, but one of the things that we do worry about, we're healthcare providers and we want to make sure that people are okay. And when we see a huge uptick, this is a public health issue. And so, we're worried about people getting hurt, and so we felt it important to notify them.
Yeah, I would say this was an unusual case. I don't know if you've ever done this before, notified law enforcement about a case. It's unusual to have such a spike in terms of cases. Typically, when people come in overdose, law enforcement is not notified. And I want to emphasize that because there may be some people out there who have substance use problems who may hesitate now to come to the emergency room, and I want to encourage them that this is not a statement of Baystate policy. This was a clear and present danger that was recognized by our emergency staff in terms of clear and present danger for the public health and public safety, and so they responded appropriately to what really was an emergency. So this is not the usual practice, and so people should feel comfortable coming to the emergency department if they have substance use problems or related conditions.
Can I just build off of that? Yeah, so just to add on to that point, which is excellent, there is the Good Samaritan law, which protects people that are using, because this is not the focus for necessarily for law enforcement, and definitely not for healthcare, but if you need assistance, to go ahead and call 911, and that's the point that's being well made here, is that our job, and we have no interest in getting involved in law enforcement, it's to protect the people. And so in the field, we are seeing family members giving the medication. Sometimes they hesitate. I've worked with a couple of police departments, and I've actually been responding to scenes where law enforcement will arrive and say, yeah, we don't care about that stuff. We want to make sure you're okay, administer the Narcan, and work from there. So if someone calls for help, they are protected under this. So it's not like law enforcement's going to go out there aggressively and arrest the person that's using. That's not the intent. It's actually to protect the people that are using and encourage people to use public safety, because we don't want someone to get hurt and stop breathing and die, literally.
And I think what Dr. Beltran did was very consistent with their role in protecting public health, and had nothing really to do with law enforcement. It was simply alerting the state police that there was a string of overdoses, and from what they were seeing from a clinical perspective, there was clearly a batch of opiates. In this case, we know now it was mostly fentanyl that was causing these very serious overdoses at an irregular rate. And then it was, separate from obviously Baystate Health's function. It was my state police detectives under the direction of Captain Wilcox and Chief Madeira and Ludlow and Chief Gillis and Agawam that then responded in a law enforcement capacity to then stem the tide that really what became a public health crisis. Any other questions?
Just, do you have the spellings of all the names of the suspects?
Sure. We're going to provide, if we haven't already, a full sort of breakdown and spellings of names and so forth. So
Perfect.
You'll have that all in writing.
All right, great. Thank you.
Sure. Thank you. I do want to thank again Baystate Health for having us in their partnership, along with Ludlow and Agawam Police Departments, and in particular Chief Eric Gillis for his kindness. Thank you.